So I've been a surgeon for more than 30 years. I was just wondering if there's anybody in the room who knows somebody who's had an operation, or perhaps you've had one yourself. Can I see a raise of hands? Oh, wow. But you know, so did I. I was a surgeon's patient also. And you know, it took that patient experience for me to understand what it's like to go to the hospital and for once feel small and vulnerable. To lie in that hospital bed after the operation and see medical practitioners come by one after another, checking out their chores throughout the day, picking their own particular part of the process that they wanted to check. I also know what it's like to lie there in bed and just want to recover quickly without complications and go home. But you know, as a surgeon, I know that surgery can be dangerous. Despite all the technical and medical advances that we made over the years, people are still going to suffer severe complications. Now picture yourself and 3 close ones having an operation. One of you is going to have a complication. And no matter what, some people still die after what we would regard as standard procedures. But there's a huge difference between some hospitals and others. And there are studies from Europe that would say that, you know, the risk of dying after a major operation may be 10 to 15-fold greater in one country over another. And believe it or not, but for the same operation, you may have to stay in the hospital 3 weeks to recover in one hospital, while in another one, it will take you 3 days to be perfectly fine and go home. So you see, if I'm going to have another surgery, I would choose my hospital very carefully. Now, what may surprise you a little bit is how I make that choice. You see, I wouldn't necessarily go to the most modern hospital with the fanciest machines and equipment and what have you. No, there's something else that I'm looking for. So what is it then with most hospitals that makes some so much better than others? And how can we deal with that problem? And why is it that the idea that I'm going to tell you about today is about to cause a revolution in surgery? So let's start with, what is the problem? Let's together move back a little bit and reflect on something. I'm sure everybody knows that you're not allowed to have anything to drink from midnight to the day of that operation, right? Well, if you just have as much as a sip of water, perhaps while you're brushing your teeth that morning, you're probably going to die on that operating table, right? Well, it's probably the best-known medical rule in the world. But you know what? It's nonsense. It's completely false. It's wrong. And still, this is being practiced in just about every hospital around the world. You see, old habits die hard. The problem is that this is not the only one of these old traditional treatments that we impose on patients around the world today. And why is that? Well, let me take you back a little bit in history. A long time ago, as I'm sure you can see on the picture, I met with a fine surgeon from Edinburgh, Ken Fearon, and he and I had the idea that we would, for the first time, put together the ideal protocol for major surgery, everything that we do around it. We would put together best practice. So we gathered a team of expert colleagues to join us in a project that we called Enhanced Recovery After Surgery, or short, ERAS. So together we scanned all the literature that we could find that had any bearing on the outcomes of patients undergoing surgery and put together that ideal protocol, the guideline. When we looked at it, we realized none of us were doing it. And we were all doing differently. So we decided to do a survey in the 5 countries that we represented and found nobody was doing it. Why was that? Well, then we realized we were up against something really big. Hospital organization. Huh? Okay. Well, you see, we've developed hospital care in departments. Surgery, anesthesia, intensive care, all moving more and more into specialization, all getting more and more technically advanced, which is fine and dandy because that is actually one of the reasons we have some of the better results today compared to what we had years ago. But the problem is that the more advanced each one of them become, the further apart they grow. And communication between them is like communication between silos, very poor. You see, you have surgeons, anesthesiologists, nurses, physiotherapists focusing on their own little part of that patient's journey, not caring about anything else but that, not seeing what might be good or bad for the patient later on. Let me give you an example. We can often use fluids to manage blood pressure during anesthesia and surgery. Now, that may solve the problem for that particular period of time. The problem is that very often the patient gets way too much fluids. And it's not uncommon that you would have a patient come off the operating table, increasing their weight by 6, 8, or even 10 pounds. Just water inside the body is very uncomfortable for the patient. It certainly will delay recovery, and it can cause some serious complications. Are you beginning to see the problem that we discovered? You see, nobody has the overview of the entire patient's journey. Nobody controls the different elements. Nobody sees the entire picture. So despite all the best of intentions, we have a huge problem, right? So the issue is now, how could we deal with this and have best practice being introduced? Well, traditionally, Ken and I being surgeons, we would look at these things from our own point of view, the surgical view. But this time we tried something completely different. We took another view. We took the patient's view. That's the only one who actually does the entire journey. And this is where we found the solution. So this is what ERAS is of today. And it's based on one of the oldest skills that we have, communication between people. So the way that we train people today is that we bring best practices to them using this new approach, the patient's view. So we train hospitals to form an ERAS team, have them sit around the table, making sure we cover every one of the silos that the patient is passing through. We take them beyond the checklist. We take them trained to communicate in a way that they never did before. Well, you may think we've done this forever, but we haven't actually, not this way. You see, now we have the surgeons and the anesthesiologists who take the medical decisions, making sure we move away the old, outdated traditional care elements and put in the new, updated ones. But they don't do it in isolation, one-on-one, on their own. No, this time they do it together to make sure that we harmonize the patient's journey. And the nurses around the table, the ones that actually carry out the work that has to be done, they know what functions and what doesn't, and they bring that to the table. Together with the dietitians, the physiotherapist, and any other health practitioner out there, they make sure to refine the entire protocol. Now, the other thing they do is they gather information about every patient that goes through their service. And they come together on a weekly meeting, the entire team, and audit what is going on. They audit their data. They see the outcomes, but also the processes behind them. This is how they target their improvements and make sure that those improvements are sustained. They also communicate to the rest of the team out there what each and every one's role is in the bigger picture. And at the core of it all, the patient. The patient is given full information of what to expect during the surgical journey. This empowers patients to take an active part in their own recovery. So, ERAS, you could look at it as the human-to-human link that secures that technology is not pushing us apart. Now, I'm happy to say that this revolution has already started. We began in 2010 to implement these programs, and it's now spreading across the world. Well, you may say, this is not rocket science, and perhaps it isn't, but it's extremely powerful. And you know why it's moving so fast? It's because of the outcomes. I'm going to show you in just a moment. But before I do, just keep in the back of your mind, if this was a new drug, a pill that was produced by the pharmaceutical industry, I think you will agree it would be $1 billion seller in no time. Because, look at this, patients will recover with only half the complications. They recover much quicker and much more comfortably. This brings down the need of hospital stay from what used to be weeks to days. And for the hospitals and other healthcare organizations, costs are coming down, sometimes dramatically. And we just found in our own study that we just published that we may even improve survival after some cancer surgeries. So quite amazing, isn't it? So the WHO, the World Health Organization, is predicting that this year 320 million operations are going to be performed. That would result in 60 million complications. Now just imagine for a moment if we could have ERAS out there as a standard of care for everyone. My vision is that we would be able to reduce complications for maybe 10, 20, or even 30 million people. You see, the next revolution in surgery is going to be based on something that has been with us all the time, talking to each other. So the next time, or if for you it's the first time you go for a surgery, I think you should do what I would do. Look your surgeon straight in the eye and ask him, do you have the ERAS protocol in place in your practice? Thank you for listening.